Good morning, everyone. I'd like to welcome you all to our webinar today called The Balancing Act, Screen Use and Mental Health Among Children and Young People. My name is Purnima Sundar, and I'm the Executive Director at the Knowledge Institute on Child and Youth Mental Health and Addictions, and I'd like to extend a warm welcome to everyone today. It's my absolute pleasure to open the first webinar in the Spotlight on COVID-19 recovery webinar series hosted by our team at the Knowledge Institute and in collaboration with special partners from across the province. I'd like to start today's session by acknowledging the traditional lands on which we are situated. Today, I'm meeting with you from Ottawa, the traditional unceded territory of the Anishinaabe peoples. As a child of newcomers to this country, I am grateful to those who have been caretakers of this land for so many years before me. I personally recognize the history, strengths, and diversity of Canada's First Nations, Inuit, and Métis communities. And as an organization, we at the Knowledge Institute are committed to engaging respectfully with Indigenous children, young people, and families within and across nations in what is known as Ontario. So folks may recall that early in 2020, at the beginning of the pandemic, we hosted a series of sessions focused on how to continue to provide high quality mental health care to Ontario's children, young people, and families. And we thought that it would be fitting, as we're hopefully nearing the end of this pandemic, to support your transition from working within a crisis to planning for recovery from the pandemic. So to this end, we have several webinars planned for over the next year. And today we're going to kick things off by starting to talk about something that has been front of mind for most of us as service providers and even as parents and caregivers and family members, the notion of screen use and overuse and the impact that this can have on the mental health of our children and young people. So even before the pandemic, most children and young people were exceeding guidelines and recommendations for screen use, as we all probably know. And this has only been amplified during the pandemic as children and young people have turned to technology for schoolwork, socialization, and leisure. So today we're going to be hearing from family members, young people, clinicians, and agency leaders on the impact of this screen use on the mental health and well-being of our children and young people. They'll share how we can move forward by presenting practical strategies for you as service providers to help families to reduce or mitigate any associated challenges. Over to you, Julia.
Thank you, Purnima, for that great welcome. So I'm now just going to review the agenda with you folks. So my name is Julia Krujava, and I'm going to be the facilitator today. So in terms of what we have planned, we really thought about our session today and how we wanted to make it interactive, engaging, and focused on what you can do to address the problem, so solutions, as well as just discussing the challenges associated. So with that in mind, we have a few brief housekeeping notes. We're going to be going through panel presentations. So as I mentioned, we have a variety of different presenters who will set the context and tell us all about screen use and the impact on young people's mental health. We're then going to be talking about how we can move forward, so practical strategies and tips to move forward. And then we're going to have a bit of a focused discussion. So this will be discussion questions that all of our panelists will be able to provide their insights on before we move into the facilitated Q&A portion. And that'll be questions that are submitted by yourselves. And then we'll do a bit of a wrap up. So in terms of our housekeeping notes, just a few quick reminders for you. Throughout the session, we do encourage you to submit questions. So you have the Q&A tool, which is at the bottom kind of center of your screen. So please submit questions throughout as they come up, because we are going to be compiling these in the back end, and then we'll ask these out during the Q&A portion. And then the other thing we encourage you to do as you participate is share with us in the chat. So I already see lots of chatter happening, which is wonderful. We'd asked folks if they wanted to just share where they're tuning in from, and then an activity off screens that they like participating in. So I see lots and lots of activity there, which is great. So throughout, if you have any insights, if you have any reflections, feel free to plug them in, and we'll make sure that we're responding as well within the chat. If you do have any technical issues that come up, you have a contact there. We'll place the email address within the chat as well, so you have it available to you. Okay. So in terms of now our next steps, we're actually going to hear from our speakers. So what you're all here for today. So we have 5 exciting speakers lined up, and we're going to start with Natasha Mcburdy. So a little bit about Natasha. Natasha is the Associate Executive Director at Crossroads Children's Mental Health Center, and she's also founding member and co-chair of Counseling Connect, and a mother of 3 young children. So I'm going to turn it over to Natasha now.
Thank you. So hi, everyone. I'm so pleased to be joining you today to talk about this really important issue. And yes, as mentioned, I work at Crossroads Children's Mental Health Center, and we work with children under 12 years old and their families. So the kids we work with, for the most part, really haven't known life outside of technology. And especially recently, we're seeing a lot of concern from caregivers around the amount of time that their kids are spending on their devices. So just to get us started, a quick synopsis of the literature and why we're concerned about screen use. So for one, we know that kids are overusing screens. So if we look at the Canadian 24-hour movement guidelines for early years, they recommend no screen time for infants, an hour or less for children's age 2 to 4, and 2 hours or less for kids who are age 5 to 17. So with these numbers as a baseline, we know that even before the pandemic, children and young people were exceeding the daily recommended screen use rates, with studies that reported that around kids were using around 3 to 4 hours of screens per day. So in terms of impact, the research is a bit of a mixed bag, but it's beautifully summarized in the report that Purnima mentioned, the report developed by the Knowledge Institute. And so what they found and what they reported were that some studies have actually found little to no association between screen use and mental health concerns in young people. And there's even been some evidence around young people reporting lower levels of anxiety when they spend more time texting. So of course, as you might imagine, these findings might be more about social connection than they are about screen use per se, but it's somewhat of a good news story. We also know that during the pandemic, technology provided a really important buffer against loneliness and an opportunity for kids and actually a lot of us to connect with friends and family. But the research isn't all positive. So there's a recent study out of Ontario that found that youth who reported 4 or more hours of passive screen time per day were 3 times more likely to meet the criteria for a major depressive episode, social phobia, and generalized anxiety disorder compared to those who reported fewer than 2 hours. And there's also some recent work out of Sick Kids that look at quantity of use, and they also found that, an hour or less of screen time has, no impact on self-reported depressive symptoms in young people, but that as screen use increases, there's a significant impact on self-reported mental health. So what the results suggest is that the issue is perhaps more about the level of consumption rather than about screen use itself. So finally, other studies have looked at the interactions between screen time, sleep, and physical activity, and how the combination of, having less sleep, less physical activity, and more screens also has a negative impact on mental health. So that's just really quick, but I think what all of this tells us is that there's multiple factors to consider when it comes to understanding the immediate and long-term effects of screen overuse, and that we need to use and approach this in a really holistic way. We also know that this is an ever-evolving and dynamic issue, which is going to require us to continue to adjust and readjust to the role that technology plays in our lives. And, it's not a new issue. There's a journalist from the New York Times in 1932 who actually did a 3-part series on the radio and how it would shape the world's future. And, she described the radio in a way that I've often heard, parents talk about video games or internet as sort of this great unknown force, having a dazing and almost anesthetic effect upon the mind. So the technology has changed, but that's not the only thing that's changed. As clinicians, we also have to move forward with the times with our interventions. So when I first started in this field, I remember, parents coming in and talking about their kids being hooked on video games. And, we come up with these very kind of black and white strategies. Well, just, get that video console, put in the truck, get rid of it. But it's not that easy anymore because we're usually talking about multiple devices and use by every member of the family. So our approach has to be a lot more nuanced and thoughtful. So we'll just move on to the next slide. in terms of concrete strategies, I want to leave lots of space for Mike because he's going to get right into the nuts and bolts of it. But what I really wanted to focus on was the clinician stance, or their therapeutic approach when approaching, screen time with individuals and families. So the first thing that popped up for me when I was thinking about this presentation was just this idea of common humanity that was coined by Christine Neff, the author of Mindfulness, Self-Compassion. And it really stood out for me because I think this is a situation where we're supporting our clients, but we at the same time are negotiating and renegotiating our own relationship to technology and to the world we live in. So I think it's important to, reassure caregivers that there's no blame or shame here, but that this issue is really influenced by all kinds of contextual factors, including how the technology is designed to pull you in, and all that makes it difficult to set family limits around screen times. The second point here is really around the idea of skill, not will. And I think that creates a gentle reframe when we're working with families. So really reminding ourselves that kids aren't choosing to rot their brains on technology. It takes a lot of skills to manage screen time appropriately. And if they could, they probably would do something different. And, to put it out to the group, like, is there anyone among us who hasn't, stayed up too late because we've stayed up to watch, the next episode of our favorite show on Netflix? It's, it takes a lot of self-regulation. And when we ask kids to get off tech and do something else, they need to know, they need to have a mastery of several skills. So, how to handle transitions. They need to know how to manage disappointment or boredom, or maybe to tune in, to respond to verbal cues. Or perhaps we're telling them, you've got 10 minutes left, and really expecting them to be able to manage and track their time. So again, with children and youth, and I would argue adults as well, we aren't always able to access the skills we need to use or interact with screens appropriately. And these are skills that we need to practice and build over time. So just to go back to the idea of binge watching and how, I think I can throw myself in that group, when we're talking about screens, we really need to use a family-centered approach. So it's easy for me to tell my kids, okay, you've got an hour of tech time per night because that's what's really good for you, and not more than that. But, if I'm then scrolling, even legitimately for a recipe or on work or, on email or whatever that looks like, we all know how good the do as I say, not as I do, work. So it really needs to be a family-centered approach and creating a plan that the whole family can buy into. So, when we talk about family media plans, not saying that parents aren't in charge or that it's, a completely democratic process, but it's really about engaging the whole family and problem solving, how they're going to engage with tech in their home, moving the conversation away from a power struggle and aligning the family together against the problem rather than against each other. And finally, just like any other harm reduction approach, the process needs to be rooted in kindness, compassion, and caring, which we know is essential as we support our young people and families to take, small steps towards defining what a healthy relationship with tech is going to look like for them and their family.
Thank you, Natasha, for that. I really appreciate what you said about modeling and the importance of really ensuring that we are setting that precedence for this is, we're saying that you should only use a small amount of screen time, or you should use screen time in healthy ways, and how we can actually do that. We're now going to hear from Raisa. So Raisa Amani is a young person with the Youth Advisory Council at the Knowledge Institute, and she's also a health sciences student at the University of Ottawa and founder of Connect STEM. She has lived experience with the mental health system and is an advocate for improved accessibility within the system. So take it away, Raisa.
Thank you, Julia. Next slide. Oh, okay. I'm not sure. I can't really see on my end that this the thing has moved.
Looks like we're just having some tech issues, but we'll get that sorted.
Okay, perfect. There we go. So as you can see here, it seems like Raisa, myself, is addicted to screens, right? So on the left is actually a screenshot of my actual screen time on April 21st, saying that I've spent around 9 hours, and on the right, which is my phone, around 6 hours. But it doesn't actually say what I used it for. So you don't see what my screen time use was for. You don't see it. Was it for school? Was it for advocacy work? Was it talking to friends? You just see that, oh, I spent around 9 hours on Google Chrome. Well, to be fair, it was exam season. But as what I'm trying to say is not all screen time is bad, but it's one of the ways that we communicate with each other as youths. But I do definitely need to work on finding a balance. So as you can see here, I did an informal survey, research with my friends. I asked peers around me and, asked like, how many hours do you use, in general, if you were saying a number about like the tech use. So as you can see on the top left, how many hours do you spend on your laptop for doing productive work? So like schoolwork, part-time or full-time work. So majority say like around 24% say they spent around 8 hours on their laptop, which is fair. And then on the right, as you can see, it's saying how many hours they spent on their phone doing leisure activities. So it would be, talking to friends, being on social media, being on Netflix. And majority say around 1 to 2 hours, but also around 21% there says around 2 to 3 hours on their phone. But lastly, I think what's really important here, I did ask the question if they think they had a balanced screen time use. And around almost 80% said they say that they're not. They know that they're not having a balanced screen time use. So I would like to reflect on COVID and how that's changed many parts of our lives. And I think with the addition of virtual schools, new means of communication, connection, so virtual activities like volunteering, extracurriculars, definitely racked up the numbers of the time that we spend on our screens. And often students like myself being in university, we're on our screens right before bedtime because, we're trying to finish assignments. We're trying to, also stay in touch with our friends through FaceTime or whatever it would be. But, it comes with repercussions. So it could be sleep quality. It could be also the immense stress to succeed using virtual means, right? And also with mental health challenges. I'm not going to list them all, but, you know what that means. However, we know from that 80% that says, we're trying our best and we know that we're not it's not healthy, but we are trying to be mindful of our screen time. So, but also there is a lack of known resources and the pressure to thrive that really adds that challenge, with the increasing screen time. So, and I also would like to reflect on before COVID. And I think we all can reflect on this. Before COVID, we had that abundance of in-person activities like myself going camping, having in-person sports, that definitely gave the opportunity for us to fully unplug from our screens. But, we know that right now the pandemic is not going away just yet soon and the repercussions after that also. So how can we truly support youth and children during this time and beyond after? So I also asked this question with the peers in that survey, what are some of the techniques that you use to reduce your screen time? So I think I'm not going to list them all here, but, we are actually, trying to be mindful and we know that it's not healthy. And we're all trying to find self-care ways to reduce that amount of screen time. However, there is also that, limitations of virtual school and also virtual activities that, will continue to rack up our screen time. And as you can see, there's more of that, but there's also a need for support from educators, mentors, leaders, and other adults in their lives for us to disconnect from our screens. Because oftentimes, myself included, we tend to forget that we're on our screens, 1 minute we're doing schoolwork, but then the next hour after that, we, go switch to Netflix just because, that's my usual way to self-care, but it's a lot of us too as well. So I think, that gentle reminder, and also for us to just move away from our screens, maybe taking self-care, off screen, or it could be during classes, they can just take an outside break instead of, just breaking the class. So that's that. So thank you so much.
Thank you so much for that, Raisa. I really appreciated your personalized approach, kind of analyzing your own screen use too as an example, because I'm sure that many of us are much exceeding the guidelines because it's very hard, right? We're working, students are working on their schoolwork and professionals likewise, and then we have lots of social time on screens as well. So next, we're going to hear from Damien Nurse, and Damien Nurse is going to provide the family member perspective. So he's a family advisor on the Family Advisory Council at the Knowledge Institute, and he's also a bit of a celebrity. So Damien is a cake artist in Toronto, and then he is the former executive producer of a Canadian television series as well. As a parent of a teen who's experienced mental health challenges since early childhood, he has some intimate knowledge of the child and youth mental health and addiction system. So take it away, Damien.
Hi, everyone. Thank you very much. So yes, my name is Damien, and I am the father of a 16-year-old son who definitely struggles with excessive screen use, and that has been exacerbated through the pandemic. What I want to do is, before kind of just really looking at sort of what life has been looking like during the pandemic, just talking a bit about sort of the trajectory of how sort of screens use kind of came into his life. In his early years, he was very energetic, later diagnosed with ADHD. And I would say that this really impacted his interaction with his peers. He was constantly getting into trouble at school, spending a lot of times at the principal's office. And we would put him into a lot of extracurricular activities to try to get him to burn off his energy. The problem was he had a really hard time sort of focusing, following instruction, and constantly sort of getting into trouble and sort of having to be told to sort of sit out and having a hard time making friends. I think a lot of times he just couldn't get those social cues. Sorry, I'm seeing if there's a note here.
There's just a few folks asking if you could speak a bit louder or turn up your volume, Damien.
Sorry.
Thank you.
Try that. Hopefully, is that better? Are we hearing me better now?
I think so. Thanks, Damien.
All right. So as I said, yeah, so he had a lot of issues making friends. He didn't get the social cues of basically kind of when he was sort of being in other kids' space. But in those earlier years, he really didn't have a lot of issues with screen use. As I said, he was really much bouncing around, doing lots of different things. But what I would say is we really noticed a change when he started hitting his preteen years. It was sort of during the preteen years that he had a lot of sort of external things that kind of came into play that I think had some impact on his screen use. First of all, there was the separation of his parents that he had to deal with, as well as a death of a friend of his who died by suicide around the same time. The trauma from these events had a negative impact on him. He was hospitalized a couple of times. And this was the time where we saw that he kind of really started going inwards to his video games at that point, probably as a way to cope, trying to not deal with the sort of chaos that was going on around him. He was starting to do a lot more of that sort of isolating, but we were trying to keep a close eye on that. But then we had another trauma that happened for the whole world, and that was a pandemic that hit. And for my son, I really saw that really affected him, and that kind of started going to his teenage years, because this sort of was that transition into the teenage years. And basically what I saw was at the very beginning of the pandemic, he refused to go to school online. Everything was sort of chaotic in his world, and he just really went into sort of the video games, watching YouTube videos. It got to the point where he was waking up in the morning, going onto screens till the end of the day. We as his parents would try to do things to limit the use of screen time. But he would get agitated, he would get aggressive, he would get a bit destructive at times, not being able to have that. We talked to sort of the mental health professionals we were working with, and at the time, we kind of said, you know what, there's a lot that's going on right now. Let's maybe just focus on trying to stabilize him. We'll deal with the screen use a little bit later. The key thing is let's just try to find a way to get him secure when there's so much chaos and confusion going on in the world around him and for him. As time went on, though, the pandemic sort of continued for a while. He did try to engage online with schoolwork, but school was never for him. And so for him to try to sit there and listen to a teacher talk and try to get him to follow instruction proved to be very difficult for him. And then he would find himself going onto his gaming devices or looking at YouTube videos or what social media, whatever it took just to kind of get him through the day. So I saw that there was a lack of structure for him. There was boredom. And for him, he really didn't care about school. So he just once again, as a teen and me working, it's hard to kind of focus on what he's doing the day when he's supposed to be doing sort of schoolwork. But that really was not happening. And then the other big dilemma that sort of happened, which was quite interesting, is that during this time, with him playing so many video games, he actually became very good at them. And there was one video game in particular that he loves, that he's now sort of ranked as one of the top in the world on the leaderboards. And he's become quite sort of popular, around the world in these people that play this game. And so he's sort of found these online friends, I'll call them quote unquote friends, that he feels like he can connect to, that he can relate to in ways that he's never been able to relate with peers in real life. And he's finding happiness within that. So when I talked to him, trying to encourage him to do extracurricular activities, first of all, it was difficult because during the pandemic, there were no extracurricular activities for him to do. And for him, what he always says to me is, but why would I do these extracurricular activities? Because in his mind, he remembers being a kid doing those activities when he was bouncing around and he would be getting into trouble and being told to sit out. For him, that's not fun. That's not something he wants to be doing. So, for us, that's kind of where we are at right now. In the pandemic, in his mind, he sort of found success. He has found calm. He has found happiness through screen use because he's sort of found this world, these friends that get him. He's not feeling the chaos that's going on in the world. And as parents, it's difficult because we are sort of now really trying to snap him out of that and rejoin us in the real world. But it is definitely proving to be extremely difficult. So I just wanted to kind of give a sense of kind of where we are and what our life has been looking through the pandemic. Thanks.
Thank you, Damien, for sharing that and for being so vulnerable and sharing about his struggles, but also his successes with this. We're now going to hear from Victoria Hatfield. So Victoria is here to share with us today her experiences as a clinician. So she is currently a youth and young adult counselor at Rideauwood Addictions and Family Services. She was also previously an addiction support counselor, as well as a street outreach worker in Ottawa. And so she'll be sharing with us her experiences working and treating problem technology use among young people. So I'll pass it over to Victoria.
Thank you, Julia, and thank you everyone for being here. I'm so excited to be talking about such an important topic. I just want to check in. Can everyone hear me okay? Somebody let me know in the chat, or Julia? Yeah, awesome. Okay. So as mentioned, I am a youth and young adult counselor at Rideauwood, and so I support youth and young adults who have addiction issues, and this can range anywhere from substance use to technology overuse, which is of course the reason that we're here today. I do want to say that a lot of what I have to say today does really echo what Natasha, Reza, and Damien have already said, and that just speaks to how important some of these points are and how strong some of the trends are that we're noticing. So I do want to first touch on very briefly types of screen use that we're seeing. So screen use can of course include a lot of different things: video games, TV, cell phone use, that sort of thing. In terms of what we're seeing with referrals to Rideauwood for tech addiction or tech overuse, we're usually seeing increased video game use, and then as well some social media use. So when it comes to video games, where there's lots of different forms of video games, I won't go into all of those, but one that I really want to highlight is the online games. And Damien had just mentioned this with his son, but online games are where youth and young people are able to play video games with real life people. So these may be people that they've met through the game or their friends in day-to-day life that they play with the video game after school. And then of course, social media can include things like Instagram, Snapchat, TikTok, things like that. We're also seeing more in-game gambling. So some of you may have heard of loot boxes in the game Fortnite. And this is an example of occasions where real money is spent to receive a randomized digital prize. So young people are spending money that they've acquired either from birthdays, or maybe they're taking their parents' credit card number, and they're spending money on something that they can't predict the outcome. We're also seeing more clients being referred for iGambling. So internet gambling, this can either be on the computer or on a mobile device. And an example of this would be mobile sports betting. So people can make bets on certain outcomes, even within an individual sports game. And so we will hear young people telling us that they're checking their phone every 5 minutes, every 2 minutes to see updates on the game and how their bet is going. And finally, interestingly, we're not just seeing young people playing video games excessively. We're also hearing from them say that they are doing a lot more watching other people play video games. So there's a lot more video game streaming. An example of this would be the platform Twitch, where people will record themselves playing video games, and then lots of young people will spend time watching other people play video games. So again, Natasha, Raisa, Damien, they've already spoken to a lot of these points. Why are people overusing screens? Why are we seeing youth turning to these devices? So it creates stimulation, right? It relieves boredom. It's releasing those reward chemicals, that dopamine. It makes them feel good, sometimes with relatively low effort. And as Damien had mentioned again with his son, it can really be a social gathering. So especially in the case of online gaming, or when we're looking at people's passing time on social media, they can really feel like they're gathering with friends. And for some young people, their online friends really make up the majority of their social circle. So it's a really important activity for them socially. And again, as we've already heard, we're hearing from a lot of our clients that they're experiencing these other difficulties in life. So they're anxious, they are being bullied. And so building this new world in a video game, or getting lost in social media or in TikTok, it can be a form of avoidance coping. It can be a form of escaping those issues that they're dealing with. And then again, as Damien mentioned, lots of young people feel like video games are what they're good at, right? They may have trouble in school, they may have difficulty with making friends, or they may not be good at sports. And so when they level up in these games, or they do really well, they really feel like they have this sense of accomplishment. So the impacts of COVID-19 on screen use, we've heard a lot of this already, so I won't focus on all of the points. But again, early literature and our own observations are telling us that screen time has increased. So I've been at Readaway for almost 5 years, and there's been certainly a very noticeable increase on the amount of referrals that we're getting for tech use pre-pandemic versus post the onset of the pandemic. So we maybe had a handful of referrals for tech use pre-pandemic, and now we're seeing quite an increase in video game use and social media use and that sort of thing. And of course, this is due to a variety of factors. So, the online learning that Raisa mentioned and Damien mentioned, and other restrictions as well. So for example, when the pandemic first hit, and even now, a lot of our counseling sessions turned to virtual. And so a lot of these young people would spend, all day doing online learning on their computer at home, and then they would log on for their counseling session online on a video. And so that's a lot of screen time for these young people. There's also less supervision of screen time. So again, with the online learning, as opposed to a young person being in class using a Chromebook with the teacher walking around, they may have been at home. Parents may have had to go to work or work from home, tend to other obligations. And so young people are having more freedom to, do other activities than what they, quote unquote, should be doing on the screen. We've already heard, the lack of extracurriculars and pro-social activities. And of course, just those overall disruptions to family routines. So parents are stressed, kids are stressed, everyone's turning to technology. So impacts of problematic screen use that we are seeing as counselors. Again, in the interest of time, I won't spend a lot of time on this. Increased mental health issues and physical issues. We've heard of this. Reduced attention span. And, sometimes we'll be meeting with kiddos online for our counseling sessions, and we can see that their eyes are going from screen to screen, and we can tell that they're focusing on something else other than their counseling session. Something that I do want to mention is there is evidence to show that, especially for those young people who are spending time playing video games with the in-game gambling that I mentioned, there is an increased risk for developing future problem gambling behaviors in their life. So that's something that is interesting to keep in mind. And then, the strain on family relationships, of course, and an impact on self-view. And this is especially evident when it comes to social media. So those young people who are spending lots of time on TikTok or Instagram, kind of seeing the highlight reels of everyone else's life, they start kind of playing a comparison game, and their self-view begins to deteriorate. And so difficulties in working towards a healthier screen use. So as Raisa mentioned, most young people do know that they're overusing screens. This is not a surprise to them. And so what is it that makes it difficult? Like, they know that they're using these screens excessively. Why is it so hard for them to get back to balance? So the first thing that we have to remember is that most video games and social media apps are really designed to be addictive. They're designed to keep us hooked. Natasha mentioned that, probably a lot of us have had moments where we had difficulty putting down our phone. So these apps are really effective at keeping us hooked. Another thing that we have to keep in mind is that tech use can't be eliminated completely. There's no abstinence when it comes to tech use when it's problematic, as opposed to maybe substance use and things like that. And so youth report mixed messaging, right? They're being told that it's very helpful in the school setting, and we're doing this webinar on using technology right now, and that's great. But then when they sit down to play their video games after school, they're being told it's harmful, and so that can be very confusing for them. As we mentioned, some youth are using screens to cope with other unresolved issues. So if we take away, the console or cut off the Wi-Fi, those issues are still there. Another thing that young people are telling us is that they do notice, again, they are aware that their screen use is a problem, and they actually feel quite a bit of guilt and shame about it. And so this actually exacerbates the cycle because they feel guilty, they feel bad, and of course, to alleviate those symptoms, they play their video games or they go on social media to feel better, and then that just exacerbates the cycle. And then the other thing to note is that sometimes tech use isn't observed to be a problem until it's having some more tangible impacts. So when it comes to other addictive behaviors, such as maybe substance use, we might notice it a little bit earlier and be able to work towards improvement. But when it comes to tech use, again, some level of it can be healthy. And so it can be hard to notice when it becomes a problem until there's maybe some grade dropping or financial impact. And so then it may be a little bit more difficult to work towards that balance. That being said, there's lots of tools, lots of interventions that we use as counselors that young people find to be effective in developing that healthier relationship and that sort of harm reduction approach to developing balance of screen time. I won't spend time talking about that. I'll let Dr. Cheng talk about that in the next part of our webinar.
Thank you so much. All right, and thank you for everyone for sharing so far, all of our speakers for sharing about their different contexts and their different insights that they have into this challenge. I've seen lots of conversation already happening in the chat as folks are already kind of thinking of, what's the solution? How do we address this? It is so addictive. All of these challenges that we're facing right now as we're kind of emerging from the pandemic and as we know we'll continue to face. So we wanted to dedicate a good portion of our conversation today about how we can move forward. So we know a lot of these challenges that we've heard, maybe we're gaining a few additional insights, but how really can we move forward is the question that we've been hearing from folks. So now we're going to move into this section of our talk today. And starting us off to talk about how we can move forward, so practical strategies and tips, is Dr. Michael Cheng. So Dr. Michael Cheng is a child and family psychiatrist at CHIO, and he's also an associate professor in the Department of Psychiatry at the University of Ottawa and the founder of ementalhealth.ca. He has really dedicated his career to helping families cope with and manage modern society, as well as re-engaging with nature and with hobbies that are fulfilling. And so I know, again, there's been lots of chatter already in the chat about this and potential strategies to address this. He's also a parent and he knows firsthand some of the challenges. So I'm going to now pass it over to Dr. Cheng.
Thanks very much, Julia. So the most important part of my bio, I think, is just to stress that I'm a recovering StarCraft Tetris addict myself. I'm married to a Netflix addict, an Amazon addict. And as a parent of an 8-year-old and 10-year-old during the pandemic, I've seen them develop an iPad addiction during this pandemic. So I'm very grateful to be here with other families and people that share the same concerns, because this is a wicked problem and we all need to work together to figure out how to deal with this issue. So we'll be talking about strategies that you might find helpful. The focus is more on just principles, because as you can guess, in 15 minutes, we can only cover so much. We'll go on to the next slide. And the approach I will present will be an integrative approach. Since the pandemic, we're all using more tech, and the approach post-pandemic compared to pre-pandemic in dealing with these issues is that there's a lot more acceptance that there's just going to be more use. And it's less of that abstinence model where we say, you know, cut off all the tech, but it's more gently tweaking, gently nudging, making that 0.5% change a week or 1% change to just get a bit more healthier use of tech and less unhealthy use. Next slide. So I'm going to be presenting some slides and approaches that I work with families. And so you can feel free to reuse and recycle these materials. So the good news that we always start with families is that technology can definitely be helpful. And then we talk about the bad news. Bad news is we're all using a lot of it, and there are ways we can shift to get a better balance. Next slide. With families, we talk about that distinction, as Reza said earlier, that you know, just the number of screen hours doesn't really give the whole picture, that it's how you use it. So there's definitely helpful uses of screen time. So just like you can use, there's healthy foods that are nutritional, there's also healthy uses of screen time, like schoolwork, learning, live video chat. And then just like with food, we have junk food and processed foods and sugar-rich foods. There's also recreational uses, like just playing a video game endlessly, or surfing social media in an unhealthy way, or just watching endless YouTube videos. So life is not about this extreme of cutting out all recreational screen time, but it's about finding that right balance of the healthy and the less healthy. Next slide. So this is a powerful analogy, the concept of healthy use and less healthy use, because it fits with what people already know. People already understand the concept of the food pyramid, that we try and have healthy foods. And if we can get all the healthy foods in, then it is okay to have a bit of dessert or high sugar things, or chips or cake or chocolate or things like that. Next slide. And so we now talk with families about this concept of a healthy digital diet. And at the base, we try and make sure you get in your healthy use of using technology to learn or work. And then after you've got that in, then maybe there's a room and a space and time for video games or just watching recreational videos. And then the studies show that although we use a lot of social media, some of the social media in particular can be quite harmful, as companies like Facebook know. And that's why you'll see social media is at the top of that pyramid, where we should ideally have the least of that. Once you explain that concept of the pyramid to the families, back to the, thanks, Bobby. So once we explain this concept, the power of it is that then families can often answer a lot of the specific questions they might have, or even the kids, right? So with my kids understanding these concepts, and then they ask me, well, can I play Crossy Road Castle? And it's just, 8 a.m. in the morning, I can say, well, do we start having chocolate in the beginning of the day? And then they can answer, well, I guess not. We have to have healthy food first. So it's the same concept. Next slide. So another powerful concept is, I like to use the 4 M's. This is a mnemonic from the Canadian Pediatric Society. And it's quite it's a good simple model, the 4 M's. And it's quite flexible as well. You can adjust it to whatever strategies and tips you want to use. So we teach families the 4 M's, and the first M is manage use. Next slide. So what does that mean? Well, first it means making a family media plan. And so with many families that we see, because the tech is so new, families haven't thought about things like having screen-free zones or screen-free times or screen curfews. It's just, this technology sort of just creeps up into our lives. And then before you know it, it's taken over. Actually, just a quick question for Julia. Can you give me a time check? How many minutes have I been speaking so far?
Just under 10 minutes, another 5 minutes or so.
Okay, perfect. So make a family media plan is a helpful exercise, and it forces families to think about the limits they're going to have. And for every family, it's going to be different depending on the age of their child and the issues their child has. Next slide. Making a schedule makes it real. if you just talk about concepts with families and give them a whole bunch of things to try, I find, some families can keep that in mind and do it, but making a schedule and writing it down on paper is powerful. I'm a big believer in atomic habits and having things written down. So we try and construct a daily schedule, co-construct it with the youth and the family that has routines that give purpose, hope, belonging, and meaning. And then we make sure that there's some tech time, and we also make sure there's limits. And those limits include making sure you know that during meals there might be not tech time, or making sure there's a screen curfew, for example. Next slide. And it's also important to go through making a weekend schedule as well. Next slide. It's also helpful to think about the role of technology. So as some of our speakers spoke earlier, some people are using tech because they're bored. Some people are using tech because they want social connection. Some people are using tech because they're emotionally overwhelmed. And so it's not simply cutting out the tech. We need to provide alternatives to help them meet those underlying needs. Next slide. Parental controls are very powerful and helpful. It's a lot easier to set up those controls so that device shuts down as opposed to grabbing it from your upset, screaming child. Next slide. Definitely much easier to have that device say you've reached your limit as opposed to having the fight. Next slide. Next M is make it meaningful. Next slide. And that's about using the tech in a healthier way. Try and use it to create things, invent things. And studies also show that certain apps like relaxation apps, exercise apps, weather apps, reading apps, education, mental health apps, those are going to be more associated with people describing better moods. Next slide. There's lots of great teacher recommended apps now. Next slide. And mental health apps include the following. Next. Another concept is that we said earlier that these technologies are designed to be addictive by design. And so they're addictive because they give easy dopamine. And so we can mindfully try and structure activities so that we train our kids to get used to less dopamine. And so a simple example would be, instead of just buying rich sugary foods, we buy less sugary foods. Instead of getting the latest exciting tech, purposely hold back on it and try and go more retro. Next slide. And we often hear about it's important to have mindfulness. Well, mindfulness is important because it trains them to tolerate low dopamine. And so there's all these things that used to be built into our society that did that naturally. The fact that in the past you couldn't just go to a drive-through and get quick food, or in the past people went to more religious services and that forced you to sit through 1 hour of low dopamine. And so we can try and purposely rebuild these activities and routines into our lives. Next slide, and next slide, next. Yes, so model moderation. We have to be good examples for our kids. And in this work that we do, oftentimes we know if we can only do a better job as parents at modeling these things, it helps. So we tell families to make sure you have lots of non-electronic family routines, board game night instead of movie night. Next slide. Try not to use your screens in front of your kids. Next slide. And this is where I bring up the Steve Jobs example. So Steve Jobs didn't even really let his own kids use tech. Next slide. In fact, when he told his engineers to create the iPhone, he said, make me something so I can read my email on the toilet. Next slide. And so the joke here is that try and use your smartphone how Steve intended. If you want to check your email, go on the toilet and check it there. That way your kids don't see you using it. And I actually have a little life hack. I have an iWatch, and so any notifications come up on my watch, I can quickly look at it to see if it's urgent, and then I don't have to pull out my device. Next slide. So I'm going to zoom through some of these. You'll all have access to the slides, but screen-free zones, next. Mindfulness. And mindfulness for a lot of the kids we see, it's not going to be sitting down and doing yoga. It's going to be doing something that's a focused activity without distraction. So it could be something like baking or cooking. It could be something like doing chores. And there are more and more studies that suggest our kids nowadays simply don't have enough responsibilities that kids might have had a generation ago. And that lack of chores and responsibilities deprives them of a sense of purpose. Next slide. Last one is monitoring. Next. So try and set those parental controls so you can get a sense of what apps they're using and how long. Next. And if you're still struggling, there's many ways to get help. So that essentially is the presentation. I'll just say there's definitely complications where if kids have ADHD or ASD or sensory issues or other things going on like depression, anxiety, or stress, then definitely we're going to need to use more specialized strategies. Next. And there's many places we can find help from, for example, all the agencies that are represented here today. Next. And that's it. Thank you very much, Poppy and Julia and everyone.
Thank you so much, Michael. So we hope that provided you with a few strategies to get started. Of course, we're going to continue to discuss this, and we're also going to share a resource list with folks who registered for our session today. So we'll make sure that you have a number of those resources. Many folks have asked in the chat as well if we are going to be sharing slides. So yes, the session is being recorded. It will be archived and available along with the slides. So just wanted to provide that reassurance to folks. We're now going to move into our focused discussion portion. So as mentioned for this means we're going to have questions for our speakers, and we're going to ask those out before we move into the audience Q&A. If you think of additional questions as we're chatting, please keep submitting those to Q&A because we will have plenty of time for your questions as well. Okay, so thank you everyone for sharing lots of chatter in the chat and lots of questions so far. One of the things that is particularly challenging is actually knowing as a parent or as a service provider when screen use is problematic. You know, we're often on it so often. So how do we determine when screen or technology use has become problematic? So this question is for anyone who would like to answer.
I can answer, but just from my perspective as a parent, I mean, I know there's lots of back and forth. And one of the things that I saw being problematic with knowing is just sort of seeing when he is not interacting with family, or just when he's kind of really sort of shutting down from just, yeah, basically kind of interacting. And that to me was sort of the biggest thing when trying to go visit family or what have you. And then it was like, no, like video game was more important. So, you know, for me, that was one of the biggest indicators. So I said when he was younger, he was very lively and loved family, and just all of a sudden not caring and just sort of isolating. That to me, that's a huge problem there.
I see lots of head nods with the withdrawing, isolation being a few cues to that it could be problematic. I don't know if others want to comment on this. Michael?
Yeah, I'll just echo what Damien said. We often talk about the 3 Ps. So as Damien said, if it's causing any sort of problems, and a problem is whatever a family thinks is a problem. The other P that we use is it pervasive? Is it happening not just at home, but in other environments? And then the other P is it persistent? Is it something it's not just a blip, right? Is it still continuing, that they're continuing to have issues? And I would say it's good to have a very low threshold for saying that this is a problem. It's not like the treatment is going to be starting a chemotherapeutic drug or starting some medication. The treatment is simply just tweaking our routines or tweaking our lifestyle. And I really believe it's never too late. It's never too early to start tweaking our routines so that kids can be healthier and make them work for that dopamine.
Anything else to add from folks around how you determine when it's a problem? Or is that
Yeah.
sound?
Yeah.
Sorry,
Oh.
Rachel, go ahead.
Okay. I think to add, because I know myself, I've been trying to be more mindful, but I do have a younger brother who grew up basically when social media started, right? And every time we go on holidays, like, is there going to be Wi-Fi? Like, and I think that's a big issue with, like, I mean, for myself, like, I do need Wi-Fi for work, but I think for him, right, Wi-Fi is for that social media, for that gaming. And I think, like, at that point, I was like, look, we are going away to camp in the middle of nowhere. So there'll be not Wi-Fi, there won't be any service. And then I think at that point I saw, like, there's an issue, and, like, I was trying to talk to my mom, like, this is becoming a little out there, but I think after that, she started being more mindful of how much he's trying to consume media. So there's that as well.
I was just going to mention as well, and this is echoing what everyone else had mentioned, but a lot of the times when we're looking at, when is something a problem, especially when it comes to something like tech, which, as we said, can be a hobby, it's that question around how is this different from this young person's normal, right? So if your child was previously shy, or they were maybe introverted and they're still shy because they're playing video, that may not be, they might just be a shy kid, right? But if they were playing sports, if they were spending time with friends, if they were spending time with family, like Damien, your son was, and then suddenly we're seeing a change in that, they're spending more time in their room than they used to, then we know it's a problem. So is this different from my young person's baseline? And then another thing I would say is, as an addiction professional, especially when we're working with substance use, a lot of the same principles apply. So of course, if there's any withdrawal symptoms, so how they feel when that tech is taken away, right? So very similar to you, Raisa, when you're saying, brother's kind of freaking out if there's no Wi-Fi. If they have to go to a place where there's going to be no tech, or if they're not using their tech for a period of time, how does that make them feel, right? Does that make them feel anxious? Does that make them feel uncomfortable versus just, not using it for a period of time and doing something else instead?
Thanks, Victoria. Yeah, I think you added some great insights there too around what was their behavior like and their personality like before. Is there differences in that behavior after? So another question, and actually I've seen this in the chat as well. Folks are asking about, are there specific challenges or specific strategies when we're working with younger children? So if we're looking at our really young kids, and now the amount of time they're spending on screens has increased as well. So anyone wants to comment on this?
Yeah, I think the younger kids, just going back to the idea of the food pyramid, I think, they are potentially able to engage in it in a sort of playful way, using the metaphor as an imagery to help them understand the concept. And I think those younger years are a great time to start building healthy habits and healthy relationships to tech. So, going back to Mike's, the routines and the problem solving, and having them engage in that process and setting up those routines with you, I think it's just such a lovely time to do that. And that really sets them up with those skills for the future. So I think, in the early years, really early, the infancy, we want to avoid it. But then after that, it's really helping them build that positive relationship with technology where they are able to access the skills to moderate their use.
Yes, I'd like to echo that and add that as a professional, as a parent, I think the early years are a great time, as we said, to foster healthy, non-electronic habits. And although the guidelines say, maybe a bit of screen time starting age 2 and onwards, I would really go and say, try and have 0 recreational screen time, at least until age 5. And then maybe after age 5, you can start to introduce some sort of, recreational screen time. But the longer you can delay that screen time, the more you're training these young kids' brains to be able to get their own dopamine, to make their own dopamine without electronics. And the speech and language research shows even having a television in the background makes it harder for kids to learn language, because their brains get overwhelmed by all that excess stimulation. So for younger kids, it's actually better to not have any screens at all.
Thank you both. And then I guess,
Can I,
go ahead, Damien.
add one thing? I mean, just interesting. And once again, this is for me looking back as a parent now, because hearing this, I think one of the key things as a parent or caregiver is that consistency, because we can talk about doing these things. It's easy to say that. And I remember as a parent, like, okay, this is how I'm going to be. But life is difficult. As we've talked about, we as humans are using screens everywhere, and it's so easy. And sometimes you're tired and it's like, oh, you know what, it's whatever. Like, even though I said I'm never going to let them use screens or whatever, it's just easy. And it's amazing to me how quickly kids, it's that same thing, you know, you give them an inch, they take a mile, and how quick that is for them to really sort of get caught up in that. So I think, you know, I would say as caregivers, like it's a lot of work, but it is important to find those ways to be very consistent, making those plans that we just talked about there. It's easy to lose sight of that, being tired and so forth, but it's beneficial, and it's hard work as parents, but it's crucial.
Yeah, I want to add something to what Damien just said. Yeah, as a parent, we are overwhelmed. And so sometimes you're tired and exhausted. Someone has a screen, you use that screen. And so there's no black and white here, but there are different levels. I think knowing what we know now about screens, you know, with societal policy changes, you could ideally legislate screen time to be less harmful for younger kids, right? So the type of screen time you see for young kids now that's marketed to young kids, it's actually quite addictive. But you could make it so that it's more like slow TV, you know, like just nature scenes without too much stuff, without rapid camera cuts. You can redesign it so that even if we are going to give young kids that screen time, that it's less toxic than what it is now. Anyways, huge discussion. Could talk on and on about these concepts.
Yeah, I do appreciate you bringing that up though as well. Of course, all of your insights, but Michael too, about the fact that it can't all be on, I don't think it can all be on families, right? So there's got to be some larger discussions as well, of course, in the sector, in the child and youth mental health and addiction sector, but also perhaps governmental and those policy pieces too, I think. So we talked in that sense about what can we do when they're young. What about if we're seeing it now as they're adolescents? We know, you know, they are their own people. They have their own ideas about how they want to spend their time. So in that context, do you think, are there specific challenges or strategies that you want to draw out that dealing with that specific age group?
I guess I might say that with the teens, we do a lot more work in, of course, doing allying with them. We can't just tell them what to do. We try and teach them what we need to be healthy. I try and teach them about, you know, we need a sense of purpose, hope, meaning, we need our basic needs. And then within that, let's make sure we get that into your life. And then the screen time gets added on top after the other stuff has been there. And then other than that, I would send them to Victoria.
So, and I was going to say, you know, there are some unique challenges for sure when it comes to adolescence. You know, of course, you know, video games is something we see a lot of. And another unique one would be that social media piece, right? Adolescence is a time where they're kind of figuring out who they are, how they fit in. You know, and if you don't keep up with that Snapchat streak, you're maybe falling out of that group or whatever, right? And so I've had people tell me they really feel like they need to do this in order to stay connected. And so I do, you know, a lot of what you said, Mike, and that, you know, looking at the pyramid, I also find something that resonates with them is most teens tend to understand that we can't put all their eggs in one basket, right? I ask them, would you eat only one type of food? Would you only, and they're like, no, probably not. So we can't depend on any one thing to make us feel good. And I think that on a bigger level, they do understand that, right? And so then again, looking at those other ways of getting dopamine. And also I like to use the analogy of a volume dial. So video games or social media maybe bring us to a level 10 for dopamine. Going for a walk maybe brings us to a level 6. That's okay, right? 6 is still better than 0, right? We don't have to be at level 10 all the time. And so again, I think using those analogies and making those comparisons, they do start to understand that, okay, I don't need to be at a level 10 all the time, right? And they're able to really understand that and get behind that.
Quick comment. Thanks so much, Victoria, for that food analogy add-on. Would you only eat one food? I'm going to use that.
Anything else? Anything else that folks want to highlight? So specifically thinking about our adolescents, our teens.
I guess I might just add not to get discouraged. Like I think you said it's a wicked problem. Like it really is. And it's something that, you know, we want to try to influence and we want to try to educate and we want to try to instill the best of habits in our young people. But at the end of the day, they're making a lot of their own choices, and we have to be confident that, you know, they're soaking up what we put out into the world as well. So if we're modeling our own appropriate screen use, I know we've said that, you know, throughout the presentation, but I think, you know, that will have an effect, and our kids might not be ready to make those baby steps with us. But then it's focusing on what we can control, which is our own use, and sort of creating those family rituals or routines that invite them into something better if they're ready to take that opportunity.
Thanks, Natasha. So I know the other one of our other questions is just when we've determined that it has become problematic technology use, what does that look like in terms of assessment and treatment next steps? So this is probably looking more to our agency folks and clinicians to respond and tell us what that looks like.
So when we're deciding that it's become a problem, by all means, send them to Readwood if we feel like that would be, you know, if your young person is 12 to 25, by all means we can support them. But in terms of assessments, in terms of standardized assessments, we do have one assessment that we use sometimes, the internet addiction test. But if we're being completely honest, this is an ever-changing issue. I think there is a lack of you know, really formal, solid, valid assessments that can assess especially younger people's use. So I think this discussion is really sort of opening the door for the opportunity to start, you know, developing some of those things. In terms of next steps and what we can do, you know, I think it depends too on what some of the underlying issues are. So when it comes to maybe they're just hooked on the tech, or they're, you know, getting that dopamine, there's a lot of work that we can do in terms of, like we've already talked about, setting schedules, setting timers. A big one would be breaking the routine or the environment. So something as simple as if they play games, video games in their bedroom in the same place, can we rearrange the bedroom? Can we move the console into a different area? Things like that. If there's underlying issues, so things like autism spectrum, ADHD, those types of things, that's actually when I'm going to send them to you, Michael, because those are some of those other things that maybe fall out of the scope of addiction and are more actually rooted in some of those other issues.
Thanks, Victoria. I'll do a quick comment on screening. So there's, I think I'm safe to say most agencies don't do a formal screen. Even CAMH probably doesn't. But many of us do an informal screen, like we have the HEADS-ED, which is that mnemonic that helps you get a sense of how they're functioning at home, how they're functioning with their education, how they're functioning with their activities and drug use and suicidality and safety, and then emotional issues. And so that sort of screen gives you a quick overview of their function. And then if they're having troubles functioning, well, then that helps flag tech use as a problem.
Yeah, I would agree. And I think we approach it really similarly, as we really just try to understand the family's concern. So how is technology getting in the way? And then what is underlying that behavior? And so, you know, really trying to understand the child's concerns and what needs are being met or not met. And similarly, the family's concerns, and then together engaging them in a process of problem solving. So, you know, I think that's really where we want to focus, is how we build skills for the family to work together, because again, they're going to need to adjust this, you know, as the child grows. And so we really want to equip them with those skills and address what's underlying rather than just the behavior.
Really good points. Thank you, Paul. We're now going to transition into the Q&A. So again, we're going to be facilitating these questions, but we have so many questions through the chat, and then we also have lots and lots of discussion through the Q&A tool as well. So we've been gathering these, and we're just going to ask out some of these, as many as we can of these questions. So one of these questions that we've received is, I think, directed towards Michael. So it's around the 4 M's that you presented. So which of these is most important to address first or least intimidating to tackle when parents or service providers might be hesitant to make these changes or know how to address this?
Yeah, so I'm just reading over that question. That's I'm just talking out aloud. That's a tough question. So we have a situation of a child who's going into, going from the green zone into the yellow and then the red zone. So they're having troubles self-regulating. And then so I guess my answer would simply be, we'd want to understand what keeps them in the green zone, the calm zone. We'd want to understand what is it that's triggering them into the yellow or the red zone. And then based on that, that would be the answer, I think. Figure out what keeps them green and doesn't trigger them. And so it may or may not be one of the M's. It could be one of the M's. It could be something else entirely different. So, so I'll give so I'll just give that general answer for now. Hopefully that helps. And then if you want a more specific answer, tell us, ask it again.
Thanks, Michael. So another question that we've received is, what is the brain most open to training for less dopamine activities? Does it follow teen brain development, or could it be harder to do? So I think that question is really open to anyone. It's around, how do we train? We've talked about, engaging these kind of lower dopamine activities. How do we do that? Or are there some activities that would be good to start with in that regard?
So I'm happy to jump in and say, so it's easier to train the brain when kids are younger, and it's easier to train them before they've gotten used to easy dopamine. So train them before they've gotten used to the joy of virtual reality video games. Another tip I'll add that we haven't said earlier is that transition periods are a great time. So if your kid is addicted and has too much tech and you want to cut back, it's nice if there's a natural transition. So something like, well, summer's coming to the end, or going back into the school year. Let's try and make a change, right? Or another transition might be, you might say, hey, it's with the pandemic, we haven't had a chance to get together on a holiday very much. Let's go to Algonquin Park for a week. And then in your mind, you're really thinking that this will be a chance for a detox. So making a transition can be one way to introduce that.
Yeah, I think that's a great strategy, because in addition to early, right, if we haven't, if that's not when it appeared and when it's become most problematic later, what can we do? And it's kind of the suggestion of those transition periods. Something else that we have quite a bit of chatter about in our chat, so I will bring it up for comment and reflection. So it's not a question per se, it's a comment, but there's a dietitian and then a lot of folks chiming in about could it. So I'll read the comment. I would suggest not to use the analogy of with children that compares technology to food use, as it could, folks are struggling with their relationship with food, it could be concerned that adding comparisons to technology could cause harm. So I don't know if anyone wants to comment on that. There's lots of communication in the chat about it, about, what do we think about the connection between tech and food, and could that actually cause unintended harm?
Yeah, I'd like to comment on that. I think that's a great point. I honestly think for most kids, they'd be okay with that concept of the food pyramid, because it's a concept they already understand. Parents understand this concept. They can scaffold this onto their learning. But I would agree with you. There is a population that can be triggered by discussion about food. So at CHEO, for example, we have kids who have issues with food. And then for those kids, I would agree, we wouldn't use this analogy, and we would frame it differently. We would just say, well, here are the things your brain needs, and then we could do it without using the food analogy.
Okay, so another question that we have is if screen time is meeting a need that the child or adolescent has, then how do we find something that replaces that? So I know, for example, as Damien was sharing, it seemed to be meeting a need for your son, Damien. It was an area where he could connect. He had a community. He was finding, success within that. So how do we go about, do we replace that with something? How do we navigate that piece?
I can take a first go at that. I think that's where it's so important to engage the young person in the conversation, and to start, wondering with them what might be something fun that the family can do if they're able to engage in that and willing to engage in that conversation. But I, think that maybe just prefacing that, as Victoria mentioned, like maybe it's not going to take you to a 10, the walk might take you to a 6, and that's okay. We can try lots of different things before we find things that we enjoy doing. And building on what's already working. So if a child already enjoys swimming lessons, is there a way to do more swimming, for example? So I think, having the ongoing conversation of let's try these different things and come back and see how they're working. And then from there, we can continue to build on successes, or saying, well, we tried it, it didn't work, and, let's go back to the drawing board, but engagement primarily.
Yeah, I agree with that. The engagement piece. I think we as clinicians, we understand that most of these issues or most technology use is stimulating. However, what I do hear from some youth is that, some of them are saying, yes, it's stimulating, it's relieving boredom, but some actually tell me whether or not this is what's happening in their brain, it relaxes me, right? It makes me feel, helps me wind down before bed. It helps me take my mind off things. And so sometimes I try and see what it is they're getting from it. Is it stimulating? Is it seem to be a relaxing activity for you? And how can we find an activity that sort of emulates that effect you feel like you're getting from it? So if you're using it to wind down, maybe we can find something else to wind down. If you're using it to stimulate yourself, maybe we find an activity that does that, like exercise. Something interesting that one of my colleagues on my team shared with me was, can we do some of the things that they're maybe doing in real life? This may be a niche sort of example, but if someone really likes racing games, can we take them to the racetrack, and as a family, something like that? Or, if they like fighting games, can we maybe put them in martial arts, or just something to sort of have them experience that real experience? And again, the whole piece is that engagement with others.
I think, Damien, you might have had some thoughts too. I saw your hand go up earlier.
Yeah, so I was just going to say, one of the things that I've been trying to do as well is, with all the online uses, sometimes just trying to find other kind of productive ways to look at it or reframe it. So, for example, like with him and his, his love for this one video game in particular, he's also kind of going on like TikTok and stuff and seeing sort of people creating these cool things. And while it's still sort of like in the screen world, trying to like teach him how to be creative and do things and learn how to make things has been kind of interesting to sort of see that shift a little bit, that he's sort of learning and kind of trying to figure out how to create something, having discussions about like even the future, like what do you want to do, as an adult, and he has no idea, and just sort of, kind of remind him that there are careers and so forth that can sort of, with the technology that he seems to love, like trying to talk and kind of open up his world to that. Maybe there are things, he, as I said, he hates school, but trying to show him that there could be an interesting career that can sort of incorporate the things that he's liking in a productive way. So, sometimes I'm trying to be because I know if I fight, I try to kind of say, well, try to do this or try to do that, try to, like, he does like basketball, but he's not going to, like, if I try to tell him to do these things, he won't do it. But if I'm trying to encourage what I know he likes, but trying to find a different way, I'm seeing him to be a bit more receptive to, as I said, not just sort of sit there and just play the video game or just sort of scroll through and watch videos nonstop, but trying to be a bit more engaged and, as I said, creative and using his brain a bit more in learning.
Thank you for sharing that, Damien. Those kind of real world examples from your own life and how you can navigate that with your son. Okay, I'm looking at some of our other questions. Folks are asking a lot about resources. So are there additional resources that we haven't yet? There's probably lots, but are there additional resources that come to mind that are really good tools for folks to get started? So for service providers or handouts for parents, I know lots of service providers are tuning in, wanting those handouts for parents.
So as a shameless plug for a project that I work on called ementalhealth.ca, we have some handouts about things such as technology use. We have handouts about things to do about technology use, like how to get more nature time into your kid's life. So we have some resources. And then there's also links from there to other agencies like CAMH has resources in this area on technology use. The Canadian Pediatric Society has their screen time promotional information. And then there's other agencies like Media Smarts as well. And so I think we have, pretty sure we have all those on our resource list, right, Julia or Amanda? So, yeah.
I am here. Okay. Great. Yeah, those are some great starting points. Thank you for sharing that, Michael. And I know you had lots in your slides. And just again, to mention to folks, we're going to circulate these. We'll share additional resources because I know that it's nice to walk away with something in addition to these discussions. Lots more questions coming in, really just, I think, about the challenge of balancing adolescents' need to be independent, to have their own kind of private time, their time in their room, with, of course, monitoring the situation. So some of the questions are, just any additional strategies for teens when, you're balancing that need for them to be independent and make their own decisions, while also, of course, having their well-being in mind. And part of that is monitoring their screen use.
Unfortunately, I don't have any great answers for that question, but just going back to the idea of it is a lot easier when kids are little to set some of those parameters and to create some norms in the family that support monitoring screen use later on. Once kids have the device and have that time in their room, it is difficult. And I think that as with most issues, it really comes back to feeding the relationship and really creating a space where that young person can reach out to you if they've encountered something that is too much, or they need that safe base or just a sounding board. So I would say really, as much as we have to trust that we've instilled what we need to instill, and then making sure that if they come to us, that we're calm and able to receive what they have to say and able to support them to develop that relationship or to mitigate that situation.
And I was also going to say, just as an adolescent, it's interesting. There was another kind of question about kind of playing games with your kid, and it kind of ties into that for me, because one of the things this year in particular I've noticed with my son going back to school and social media, there was a lot of sort of stresses he was having, and I could sort of overhear him talking on the phone in his room, and I didn't want to kind of say that I'm eavesdropping, but he's loud when he talks. But what I found was, if I would engage and be willing to play his video game with him, and I mentioned he's one of the top in the world, I can't stand the game and I can't stand playing, but if I just allowed myself to play with him or watch the anime shows with it and just be there and just pretend like I was enjoying it, his guard went down. And there was a lot of discussions, like the things that were stressing him out in real life and through the social media, through his kind of peers, he was actually talking about it. And I kind of took that moment, I would ask questions or bring up things that I knew were kind of an issue, but without sort of telling him that I knew. And it actually allowed for conversation to happen. So I would say that for me, I did kind of find some positives there, that just sort of engaged in those games and sort of knowing that when he was locked in his room and kind of just sensing that stuff was going on. I know there was a bit of an issue with kind of being pressured into doing using alcohol and so forth. And he came, he talked to me, he told me, he was honest that, the stress is there. And so yeah, so I would say like there was the benefits there of being able just to kind of come to his level and just engage, even though, as I said, I was miserable playing those games, but he was happy to kind of have me there and being part and appreciating that.
I love that, Damien. And yeah, that's great. Do anyone else have any comments related to that kind of second portion of the question? I don't know, Victoria, if that's something that you've encountered before, you know, can it be an effective strategy for parents, family members to actually engage with the tech? And I see Mike has.
Yeah, I just wanted to echo what Damien is talking about, that connection before direction, right? And that's that spirit, as Natasha said earlier as well, about that acceptance. So if we accept that our kid enjoys this tech, then we have to ally and engage and connect about that.
Yeah, and I would just echo that. You know, I do work more closely with the youth when they've recognized and accepted that they have an issue and would like to make the changes. And not as much with parents, although we do support parents as well. But I have had youth tell me that, you know, I tried to give up my game or my cell phone, and then I look over and my dad's on the computer and mom's on her phone, and so what am I gonna do, right? And so again, I think it does come back to that engagement, whether it is parents joining in on the games, the video games, whether it is having a family board game night, really making that engagement enticing to the youth and something that they actually enjoy doing, right? And like Mike, you said, maybe nudging towards those lower dopamine activities or nudging towards those other activities. But kids really do notice when they're feeling like, you know, family's not engaging with each other. We get that feedback quite a bit.
Yeah, so my little nudge for Damien would be, after you have a good session with your son playing that game, then you can say, hey, son, let's play a game I really enjoy. It's called Pong. And then you can nudge him to that low dopamine.
Very good, yes.
Well, thank you so much. We're about 3 minutes to 1. So I know folks will be jumping off soon, but we wanted to just, of course, thank you all so much for sharing today. We have a few follow-up items we just want to go through briefly before we get everyone back. But thank you so much for really an amazingly engaged as well kind of chat and Q&A. So I know that there's lots and lots of interest in this topic and lots of ideas about how to move forward. Okay, so we'll move into just our few wrap-up items. So of course, thank you so much for participating today. There is going to be a really brief evaluation, so it'll take 3 minutes tops. So we do encourage you to complete the evaluation. When you exit the Zoom webinar, it will pop up automatically, and then you'll also receive an email so you can complete it as it's convenient for you. And this is, of course, going to help us to plan our upcoming session. So this is the first webinar in our series, as we mentioned, our Spotlight on COVID-19 Recovery series. So we're looking forward to the next talks. We've linked there, and we'll make sure to share as well in an email how you can find out more information about our upcoming talks. So registration hasn't yet opened for our next session, but it will shortly, and that will be more targeted towards leaders, but again, open to all, so open to all who are interested around leading in a hybrid workspace and strategies that we can use to make sure our workspaces are maintaining our health and well-being as well. And then we are going to be sharing out some of those key resources. So we know there was lots discussed and there was lots in the slides. So we'll be sure to do that as well. So a big thank you, and I hope everyone has a great day. Thank you so much.